Marta first came, I guess, across one of the vets that we were speaking with was like, oh, you really need to speak with Marta. And it's been really wonderful to do so because Marta brings with her her veterinary background from Spain, her multiple years of interest within not just obviously animal health and welfare, but that from a more complementary side of things. So we have the ability within our organization now to not just talk from a human perspective, but we have a whole pile of other species and information around those species and how that impacts their lives as well to mix that in. And I think, Marta, it probably goes in both directions in terms of Marta gives to us and we're able to feed back to her. So it's really wonderful for us to work together, I think. And then, of course, for the topic of this conversation is the impact it potentially can have for, you know, our animals, what we're hoping to do with this change for Australia. Yeah.
Thank you very much, Carrie. And before Marta starts, I'll just add that I'm really encouraged by the amount of interest this afternoon. And without breaching any confidences, I can tell you that at least one of our members originally tried to start with an organisation interested in veterinary supply and was strung along by the ODC for more than 12 months. So, you know, there's definitely interest from many people in this industry. And even if it isn't current interest, I think as organisations get established, to know the options of expanding into the veterinary business would be really good to know. And I think, Marta, what's going to be really interesting this afternoon is the kind of optional path that you're investigating. You know, most people would have thought that you'd be going through the, is it the APVMA? APVMA, is it?
Yeah.
The veterinary equivalent of the TGA rather than the TGA itself. So without further ado, I'll hand over to you, and we look forward to hearing more about what you have to say. I'll just share my screen with you, Marta.
Yep.
Sorry, I'll just hand it over to you if I can. Sorry. So hopefully, can you...
Am I allowed to share now?
Yes.
Perfect.
Is it letting you do that? That's great. Thank you.
Okay. There it is. So first of all,
Marta, can you just go onto the slideshow? Might be good just to give people the full screen rather than on the side, just down the bottom. Are you able to do that? Just click the screen icon at the bottom of the slide, and then you'll go to the full.
You are not seeing the.
We can see the slide, but I think if you just go underneath this dog slide, there should be a picture of a screen. You have the screen option to show the full screen.
Oh, maybe just give me a second. Because in my screen, I'm just seeing it on full screen. I'm going to stop it for a second and try it again.
Yeah, I'll be sharing the different monitor.
Yeah. I think that's the issue, is sharing at another monitor at the same time.
If you do what you were doing, but in PowerPoint, just under the slide, you'll see a picture of a screen, and that will just give you the full screen.
If it works, this one.
No, just down below. So just go down below your slides in PowerPoint.
Yeah.
Just down below, you'll see a screen. You can have the single slide, the 4 slides, or the full screen.
No, it's not. Yeah, I know what you say, but it's not taking it.
No problem.
Did it work now?
No, we can't see any of the slides at the moment.
Sorry about that.
That's okay.
Let me see. Let's see if I can.
Okay.
So first of all, thank you for being here, and thank you, Gail, for that opportunity to have a chat a little bit about animals and about medicinal cannabis in animals. And yeah, I would like this, as you said before, be a chat. I think that we can all share. So if anybody wants to ask any question or wants to share their own knowledge about whatever I'm going to be saying, I would really appreciate it, because I think that we all can support and can give some opinions in regards all what I'm going to be talking today. And secondly, as Carrie just said, my background is Spanish, so forgive me because of my accent in some of the words that I'm going to be pronouncing maybe in a little bit weird way. And sorry if I don't find the best words to explain myself, but I'll try to do my best. So the first thing that I want to say is that, yes, as Gail was suggesting before, there are different administrations that we have to deal in a certain way if we want to use this type of medicines with animals. And this might sound weird, because sometimes it's a little bit awkward when you have one organization for certain things and another organization for some other things. And at the end, you don't really know where do you need to step in order to really be able to use these products for animals. But after being in contact with many of them, or with most of them, and also with some veterinary boards, I think we have come up with a plan that really suits what we're looking for. And even though it's just the first step of getting these products more access for animals, we do need to take this first step. And this is going through the TGA, first of all. And the reason to go to the TGA, first of all, is because they are the ones who, let's say that way, settle up the rules of where and how we can use these products. I know, and I have had a few questions from some other vets asking me about the AVPMA. And obviously they have something else to say, but that would be like a second step, because at the moment, and what we are asking at the moment, is not about a specific product. We are not dealing with any particular product. We don't want any product to be assessed or to be approved. That would be a second step. What we are looking for at the moment is for the animals to be recognized, that ability or that possibility of being treated with medicinal cannabis products. And that's our first step. That's what we are asking to the TGA. Because at the moment, many of the products that the humans are capable to use, they are banned for animals. So that's the goal of our application. The goal of our application, and what we are asking, is to reward. We are just asking for rewarding. We are not really changing any schedule, but we are asking for a rewarding of the schedule of cannabis and tetrahydrocannabinols and some amendments to make it suitable for vets to use it. And it's just to allow the vets to be able to use medicinal cannabis for animals. And let me show you what we believe is the actual situation. And again, if someone has a little bit more of knowledge in regards to this or has another opinion, please let me know. But as far as we know at the moment, most of the medicinal cannabis products are for are scheduled under Schedule 8 and under Schedule 4. This year has very, very recently been approved on Schedule 3 under certain circumstances, and only for products that are absolutely registered and are already in the list of the ARTG. Now, we have two types of products in here. The S4 medications, which include CBD products. And when we talk about CBD products, we are talking about products that are either isolated CBD or that do have 98% of CBD and up to 2% of some other molecules that do come from the cannabis plant. So they can be some cannabinoids, some other cannabinoids, they can be terpenoids, they can be flavonoid, any other molecules. But they're scheduled as S4 medication. And then S4 medications are all those medications that include THC over 2% of THC, or any other cannabinoids that do have higher levels than 2%, because otherwise they would be considered as an S4 medication. But that's, in my opinion, and for me and for the animals, that's a little bit of our problem, and that's why we are asking for the rewarding, because all these 8 actual medications, they are only for human therapeutic use. They are not allowed to be used on animals. They are not allowed to be used by vets. And exactly the same for the very recent approved S3 medications, even though there are not products yet to be found over the counter. We assume, obviously, that they will be there very, very soon. They will only be for human use, since they're only for adults over 18 years old, and that's obviously for humans, not for animals. So that's one of the reasons why we are trying to make that change, and that's one of the reasons why we are trying to get that product to the animals. So for vets, yeah.
Excuse me, Marta. This is Dirk Bielen. Is it the right moment to ask the questions now, or you want to wait until the very end?
Absolutely, whenever you want.
Excellent. For me, there's 2 things that I would like to mention. I mean, first of all, I do believe that the schedules that you just showed, that is falling under the Poisons Act in general, which goes across the different authorities going around. So that is the first point. So it's not specific to medication, but it is to according all poisons. It means also that it does reflect the APVMA requirements, and that's why they refer to the cannabinoids under Schedule 4, I believe. The second thing that I try to get my head around is that if you look on the TGA website, it says clearly under, if you type in what does the TGA does not do, sorry, what the TGA doesn't do, it clearly says veterinary medicine. So it clearly says we have nothing to do with veterinary medicines. So
Hi, Janine, it's Michael here from CBD Vets Australia. I also just want to speak to Lucinda or Peter if they're available.
Sorry, I think that was something else in between. But yeah, so for me, it was very much to understand if the TGA is loud and clear, not for veterinary medicine, I would like to see if how we then can go to the TGA for us to change in this regulation.
In my opinion, the difference is the TGA has nothing to do with medicinal, with veterinary medications. You're absolutely right. But he's the one that approves the use by animals of certain medications. And then the APVMA is the one that regulates the different products to be used on animals. So we are not, at the moment, we are not applying and we are not suggesting to have any product validated at all. All what we are asking is for the possibility of having some products whenever, as a second stage, to be used on animals. if we are not allowed to use these products on animals, then we cannot have any product at all to be used on animals. So I'm not saying that this is all what we have to do. Obviously, we will have to deal with APVMA as a next approach or on a second step. But the APVMA will not be able to approve any medication at all, any S8 medication at all, unless they have permission from the TGA for animals to use this type of products.
So what you're saying, Marta, is that the TGA is the main gatekeeper by stipulating or by omitting animals or by stipulating human use only. They are preventing the APVMA from managing the application or the availability of medicinal cannabis for animals.
Absolutely, at least with the S8 medication. And as I'll show you here, vets can have access to S4 medications, but there are only a few ways that they can have access to it with the actual legislation. And one of them would be obviously to register products, but there are non-registered products. There are non-S4 registered products for animals. And because there are non-S4 registered products for animals at the moment, and if there is any product that wants to be registered as S4 medication, yes, it certainly needs to go through the APVMA, sorry. But we are not talking about any product at the moment. So if any vet wants to prescribe any product, at the moment, they only have 3 options. The first one is to use a product already approved under the RRTG, which would be a Epidiolex, which is the only one that has CBD, and they would need to prescribe it as an off-label medication because that medication is only for humans. Because there are non-registered products for vets. So for animals, the vets would be allowed to use this one, but it would be considered an off-label medication. The second option would be importing a product that is registered in another country for animal use. And let me tell you that it's true that at the moment there are not many registered products also in any other countries. There are just a few. So the vets could ask for a special permit from the APVMA in order to be able to import those products. And then they could use these products. And the third option that they can do at the moment is prescribe through a compounding pharmacy. A compounding pharmacy that would be able to set up and to make up specifically what they're asking for, always following the legislation. That means they would always need still to be very strict with the 98% of CBD in order to comply with an S4 medication. I don't know if that answers a little bit your question there.
Well, I mean, it could be that this is the way, but I have physical proof that currently vets can prescribe a product including THC and get the product for their dogs at that moment, or their patients, mainly dogs. So either maybe they are not following the rules, that could be as well, of course. But based on the companies involved, I would say I would be highly surprised. So well, I totally understand that to get it on ARTG, but ARTG again is human medicine, and the TGA says we have nothing to do with veterinary medicine, only with human medicine. So for me, digging a bit further and having a better understanding of what is happening would be fantastic, of course. So I'm all in favor, don't take me wrong, Marta, but I fear that yeah, there is more to it. That's what I'm saying.
That's what we have concluded after talking with the APVMA. They would forward us to the TGA to talk to the TGA because there were non-veterinary registered products to be used. Whenever we spoke with the TGA, and we have spoken with different persons from the TGA, they were the ones who suggested us to try to submit that application. Because otherwise, at the moment, this was the only, apparently, that was the only legal pathway for the vets to have access to any medicinal cannabis. And for what they told us, there were no legal, at the moment, there was no legal use for any THC over 2%. That's what we were told, and that's why we submitted that application. Hopefully, that will help to open things a little bit more.
Yeah.
Marta, Despina Lord here. Just on that last slide, my understanding is that for the vet to prescribe a fully finished good, it must be on the ARTG. So regardless,
Sorry?
for the veterinary practitioner to prescribe a product, a fully finished good, it must be on the ARTG. It cannot be a product that is not on the ARTG. So either it needs to be an ARTG product, as you've mentioned on that first point, they import it themselves, or they address it through compounding. So are you suggesting the S8 amendment would be via the compounding pathway?
Until there is a registered product, it would. Obviously, that would at least open the door, as I said, as a second step for many other products to come to the APVMA and ask for them to be registered and for them to be approved.
Okay, so it would be via the compounding pathway, that's what you're suggesting?
At the moment.
Yeah, okay, thank you.
But you're also, Marta, would it be correct to say that you're also trying to prepare the regulations such that as products become registered on the ARTG, companies will have the ability to then extend their use into veterinary practice?
Absolutely, that would be the idea. So that the animals can have access to many other products that are already used on humans and that are also valid to be used on animals.
Yeah. And at the moment, we only have Epidiolex, but in future, we may have many.
That's why I say it's the very first step of a very long pathway. Yeah. Because if that gets through, and it will still take a few months to happen, we would still need to wait a few more months until we have a specific product for animals with THC approved. But again, it's a step by step. There's nothing else we can do. This is a very long pathway.
You've probably surprised everyone by talking about this, because I would have thought that 99% of us would have believed that the APVMA was the gatekeeper, not the TGA.
That's what we thought too when we first started digging in a little bit, and when we first started talking with one part and with the other part and with everybody else. And every time that we spoke with the APVMA, they were understand me well. They were very kind. They were really nice to us, but it was like going once and again against a wall, because they kept telling us we needed to, was illegal, we couldn't do anything, and we needed to go to the TGA.
I'm just going to mute everyone and then unmute you, Marta.
Okay. The only thing is, if anyone wants to talk, maybe you can raise your hand, and maybe Gail, you can give them permit to talk.
Yeah. Also, you can unmute. Can you all hear me? You can unmute yourselves. It's just that there was talking in the background. So, okay.
Perfect. Thank you. So, as I said, that's exactly what we are trying to reward. And if you have a look into the TGA, the cannabis sets including seeds, extract, resins, and plants, and any other part of the plant, when prepared or packed for human therapeutic use. So what we are adding, or what we are trying to reward, is that it states packed for human or animal therapeutic use. It's just that. It's just one word, but that word means a lot. because without this work, we are not capable to keep on going on other medications. Or to keep going further into the APBMA and regarding approving some other products and things like that. Also, just to be careful and to be very clear, we added this statement there that says it is intended, except when it is intended to be used on animals bred for human consumption. Because it's true that we still don't have enough knowledge to go further into that human consumption part of animals, especially when we are talking about SAID medications, I mean products which are high in THC. And the same with the tetrahydrocannabinols. What we are asking is for it to be reward from just only for humans into for humans or animal therapeutic use. So this is all what our TGA application is all about. It's mainly to give vets and to give animals access to medicinal cannabis, and not just to CBD, because we do consider that there are some other cannabinoids that do have medical properties and that they can really be in very, very benefit for the animals. So I do know that all of you do know a little bit, obviously, about the endocannabinoid system and how it works, but I just want to emphasize that this endocannabinoid system exists in all vertebrates. It's not only for us, it's not only for humans. It does exist in all the other animals, in all vertebrates and most invertebrates, not in insects, but it's obviously in our dogs, in our cats, in horses, in even those little lizards, so those little birds that are around us, they all have the same endocannabinoid system. It's crazy, but it's true. And it does help to promote balance, mainly. And nowadays, same as we are, animals are continuously under stressful situations. And I'm sure that most of you are aware of all the stressful or all the stress that animals are coping these days because of the lockdowns. And I have chat with many of my colleagues, and animals that are not allowed during these days are not allowed to get out of the house as frequently as they used to. They are starting to behave weird. And as soon as the owner is capable to go back to work, they are developing very, very high anxiety levels, which is all, in my opinion, related obviously with the situation, but also we can support them by enhancing and supporting the endocannabinoid system. We all know about the endocannabinoids, the anandamide and the 2-AG or 2-alkyl-glycerol. The animals do have those endocannabinoids too, plus many others like the PEA and many others. They do have the same receptors as we do, CB1, CB2, and many others. And obviously they do have those enzymes that do help to hydrolyze or transport those endocannabinoids within to the body, within to the system. And they're also capable to, not to introduce, but to be able to react with the phytocannabinoids when they come from outside of the body. They're capable to use those phytocannabinoids to support that endocannabinoid system. And we all know, and in my opinion, and I try to say that to many of my colleagues, that in my opinion, the endocannabinoid system is the main system of the body, because at the end, it does help to regulate everything around it. All the other systems, we don't know how much it can really, or how deep it can really go. But I do believe that there is really the main regulator system within the entire body. And it does help in many, many situations for the animals. So it's very interesting, or for me, it's very interesting to know where do they have those receptors? And so how can the phytocannabinoids help the animals? Well, we do know the same as in humans, that CB1 receptors might be mainly in the brain or in the neurological system. And CB2 receptors might mainly be in the immunity cells. But we do have those receptors in many other parts of the body. And from the veterinary point of view, there are 2 or 3 places where it's very interesting. One of them is the pancreas, and at least in animals, there is no specific treatment for an animal that has pancreatitis. Not at all. There's nothing. All what you can do is just to maintain the animal and give some medications to try to support him as he slowly heals. But if we think that they do have these CB1 and CB2 receptors within the pancreas, that means, in my opinion, that there is another door to open and another door to research to help these animals through medicinal cannabis medications. And I had the chance with one case up in Darwin, which had developed a cancer, an insulinoma within the pancreas. And because of how difficult it is to treat the pancreas, that animal was given 2-3 months of life. And I won't say that it was only because of the medicinal cannabis. It was probably involved many other things. We did a change of diet. We did, we added some other supplements. I had another colleagues up there in Darwin also working with the dog, doing acupuncture and some other remedies. But this dog ended up lasting over a year. So all what I can say is that at least the cannabinoid products didn't do any harm to this animal. And also regarding the liver, it is also very difficult sometimes for animals to be treated when having issues within the liver. And again, we do have those receptors there. So I do believe that they have to play their role. And it's something that we cannot forget. There are many cases, and this is just a little bit of a few indications in cases of dogs, where it can be used on epilepsy. There are already researches that do support the use of medicinal cannabis, especially CBD, but also CBD with some other compounds, let's say in a complex way, a complex type of product to treat epilepsy in dogs with very, very good results. It can also be used, as I said before, on anxiety problems, anxiety issues, on neuropathic pain, on skin problems. We have CB1 and CB2 receptors in the skin. So in all those cases, not only CBD, but also THC has a lot to do and has a lot to help with. On respiratory issues, this is very funny because when I do some seminars for some other vets, I usually tell them that just 100 years ago, 150 years ago, no longer than that, there were already patented products for respiratory issues in dogs. They were there. What happened to that? They all disappeared because of many issues in the United States, but there were already these products out there and they were already being used. So there is certainly something out there that we can use and we are not using at the moment. Obviously for inflammatory problems, osteoarthritis, hip dysplasia. How many dogs nowadays do have hip dysplasia? And especially when we are dealing with old animals, they do not cope very well with many other medications. And medicinal or cannabinoids are really a good option for them in these cases. Also in cats. And I would like to talk about the chronic gingivostomatitis. There is a disease in cats, only in cats, or is very specific in cats or felines. There is a gingivostomatitis that is chronic and there's nothing to be done to heal them. Many vets do have to take the last step to remove the teeth in order to be able to control that gingivostomatitis. Well, it's been seen, and there is a research from a university in Italy that during this process, and these cats that do have this problem, they have high numbers of receptors within the gingiva. And I do have some colleagues from South America that are already using medicinal cannabis in this type of cats with amazing results. Also, they've been using THC for cats with asthma. There is a specific type of asthma in cats, not that much in dogs, but specifically in cats, which is very, very similar to humans. So they do have crises and they get completely stuck that they cannot breathe at all. Well, I have a few vets from, again, in the United States and South America that are using medicinal cannabis to treat these cats with very, very amazing successful. So all what I'm trying to say with all of this is that, yes, the animals do have endocannabinoid system and they can really benefit from the use of it and from the use of phytocannabinoids to help them. Some of the indications that we can be using CBD, and we are already using CBD on: epilepsy cases, fears, phobias, diabetes, respiratory issues, as I said before, mild to moderate pain, sleeping issues. As you introduce new members in the family, to calm them down and again reduce anxiety. So maybe the question here would be, okay, if you can do all of that with the CBD, then why do you want to have access to the THC? Now, the point is that the THC is very, very useful and it can help in many other indications. And the problem is that because we are just using 98% of CBD and barely any THC, we cannot really treat properly many of these processes, like cancer, like autoimmune diseases, nausea and vomits, like lack of appetite, especially in cats when they have immune problems or cancer, they stop eating. And there are a few researches already also supporting the use of THC to increase the appetite of these animals. In any case of very, very high levels of inflammation or very acute and intense pain, it has already been suggested and it has already been researched that it really does help the animals. So I do believe that if we could increase, even if it's just a little bit, the THC, we would support in these animals and we would support in these processes. Obviously, there are some indications also for high THC levels, even though we have to be careful because it's true that animals, especially dogs, are a lot more sensitive than humans. And a little tiny amount of THC that for a human would barely do any effect, maybe just getting him a little bit happy, let's say that way, it can be harmful for animals, that's true. That's another reason why we are asking all these medications to be controlled by vets. That's one of our main focus, and is that all these medications needs to be controlled by vets, the same way as they are being controlled by doctors at the moment.
I'm just going to stop you there, Marta. We've just got a question on the chat line. Sarah's just asked, do you have studies that have shown that THC is more so beneficial than CBD alone or full spectrum?
There are studies, but it depends on what you are using it for. There is nothing specifically saying, okay, the THC is much beneficial than only CBD. There is no studies like that out there, but there are already researches regarding pain control and regarding epilepsy and regarding mainly most of the researches that have been done on animal, they are mainly done on pain and a little bit on epilepsy. And what you can see is that by the combination of both of them, you can obtain a better benefit regarding pain and inflammation, and you use a lower dose, which is what we are always trying to look for, trying to keep the lower dose as possible. And if we combine both of them, you can see that you use, a lower dose. Those research are mainly done in dog, but there are already a few researches done on rats. There is a vet here in Australia that has been doing a little bit of research by the combination of CBD, THC. This is all in mice though, but it's still valid. doing using the combination of THC or CBD, CBD with gabapentin or with opioids, or THC with gabapentin or with opioids, THC and CBD together. And yeah, she certainly agrees that the THC has a higher anti-inflammatory and a higher pain relief effect than the CBD. So if we are capable to combine both of them, and there are already a few researches where they combine both of them, I think we would aim our goal much easier, much better, and in a lower dose. That's what we are looking for to do.
Yeah. So Sarah's just added, and Sarah, please don't apologize, it's very interesting. Vets are usually quite specific. Vets and myself haven't been able to find any clinically significant studies to prove this, and hence why they're hesitant in prescribing THC for their pet patients. If you could share any data you have, that would be great. And just before you comment, Marta, I've got a question. Have you at all approached any of the veterinary colleges in Australia to do some research? Do you know of any research that's going on here in the colleges that could supply data for a future registration of products?
That's what we are trying to do at the moment. Every vet that I'm visiting, every vet that I'm talking to, we have developed what we call our pet journal, for them to keep track and to keep record of whatever they're doing with the animals, so that can help us support what we are saying. And regarding to Sarah, yes, absolutely, we do have some researches. I will try to share with you also our application. If you go through it, you will see the different steps with a lot of researches supporting all what we are saying, all what we are stating. We have, I think, close to 100 references in our application to support all of the things that we are saying. And absolutely, I don't know what would be the best way, Gail, for me to submit any information, but I don't know if they want to either send me an email to info@cannectvet.com, or if you want me, I don't know, to send you, or if I should share here my email so that everybody can have it. And
that's a good idea. So what we'll do, because AMCA is primarily, you know, we've got enough on our hands dealing with human stuff. Yeah. I won't offer to be the go-between. So Marta, if you're happy, if anyone at the end of this call is very interested, I'll share, Marta, your email with your permission, and they can write directly to you.
Yeah, I just shared it there in the chat. Yeah. So if anyone wants to take note of it, yeah, I would be more than happy. And thank you very much for letting me, or giving me the chance to share this research with you, and to share all the information that we have with you.
Yeah, the other thing, the TGA application that will be public next week or late this week, it will have all those references on it. So, you know, have a flick through that application next week too. Yeah. It's probably worth just commenting generally in terms of research that there's unlike other fields of research where often the animal work precedes the human work, it's kind of flipped in this environment. And so if you've got, you know, I find in the human world, because of the breadth of indications that we have access to or impact on, any one bit of information is small in one field. And so it's just the same in the vet world. It's, you know, you've got a whole pile of more species to deal with, a whole lot of indications. There's just, you know, it's early days generally in this field across the board.
Yeah, and the biggest problem, and we have talked about it, I don't know how many times, Carrie, but the number of research for humans is huge if you compare it with animals. There is such a small number of research done for animals, which is unbelievable. I think it's the first time that this happened with any sort of medication. Usually it's more tested on animals, and then it slowly develops and evolves to be used on humans. But this is not the case. In this case, it's just on the contrary. There are, I don't know how many thousands of research regarding the use of medicinal cannabis in humans, and just a few in animals. It's so good.
I think that's an interesting point, Marta, because you know, there are so many products available currently through the SAS, and as more and more products become registered on the ARTG, the competition in this space will become very, very intense. So I think the groundwork you're doing now for veterinary applications is very interesting, because it may well be in 10 or 15 years' time, this industry is looking to expand elsewhere. So certainly looking at some research into animals is really very forward thinking.
Yeah, that's the idea also. One of the reasons to do that is I believe that it's, if we can make it more available for the vets to be used to work with it, to be used to deal with it, to have the knowledge to start using it. Obviously, that knowledge will keep increasing, and we'll start having a lot of data, and that will help us to have a proper opinion and a proper control of what is going on, which otherwise it would be very impossible. So that's one of the reasons why we are trying to make all these changes. First of all, to increase the treatment options for veterinary patients. Also, try to have safer access to cannabis products for veterinary patients. Improve the knowledge, as we were just talking. If we improve the knowledge, if we improve the access, we will improve the knowledge by the vets, and also they will be able to support their patients and the owners much better. I do believe that it will help us to have a better quality control of the products that we are using. And I also want to I'll talk about it just in a few minutes, but also we have to keep in mind that even though animals are quite sensitive to THC, we are still talking about very, very safety products with very low levels of toxicity. If we compare them with many other medications that vets are already using, same as humans, exactly the same. If we're thinking the secondary effects or the side effects, or where we are at the moment with the opioids, and if we compare it with medicinal cannabis, I mean, I think we are far away from them. So that's also another reason why we are pushing so far in trying to get animals to have access to this type of medication. So regarding increased treatment options, as I said before, is already being researched that it could be a really, really good supplement or replacement for the current therapy for epilepsy in animals. Furthermore, they are less harmful than many of the actual therapy or medication that vets are using for epileptic animals. Also, there are many old animals that do need to use NSAIDs in a chronic way. And this is very, very harmful. And in many situations, in many occasions, they are not even able to use these type of medications. I had a few vets that come to me and ask me, listen, I have a dog which is 13 years old now, and I cannot use NSAIDs with them because as soon as they start developing diarrhea or they start developing some other problems. Do you think that the CBD can help me? Yes, I do think so. I do believe so. I've seen it. I've used it myself with my animals and with many other patients' animals. And it really is an option to this type of medication that you cannot use at this stage. Also, it's really another option for anxiety, as I said, for animals that do have a lack of appetite. In many other behavioral disorders, it really is an option. In cats, there is a disease very, very similar to the Alzheimer's, and it's called cognitive deficiency. In fact, there is a research out there that is going to be using medicinal cannabis on cats and trying to see if it could be also used in humans because they are very similar illnesses. Well, I have had many cats that do meow at night, and they make it very difficult for the owners and for the neighbors to cope with that meowing at night time. And this is related with that dementia in cats. and you should see how well they respond. I mean, I can tell you that I've saved the life of a few cats that have come to the practice because the owners were going to put them to sleep, just because they couldn't cope with it anymore. And there's no other medication unless absolutely sedating the animal to cope with this. And with medicinal cannabis, you don't need to have the animal sedated. He just rests and he chills and he's perfectly fine and he stands up and goes around, but it really does help them. So it's just increasing the treatment options within the veterinary world. Also, we do believe that these medications that are going to be used through veterinary control, we really do believe that they are going to be legally obtained and they are going to be legally controlled. So we are going to have products that are really free of pesticides, heavy metals, and some other toxins or microorganisms that could be really harmful for animals too. Obviously, as I said, by increasing or improving the knowledge of the vets, that would help a lot more to support the owners. It would really help them to choose what is the right medication. It will really help them to understand what is happening or what is not happening with their animals when they are having access to these medications. It would really help to follow up these medications and control any side effect that this medication may have, depending on the animal. So it will improve not only the knowledge, but it will also improve the relation between the owner and the vet, which I think is something basic for the welfare of the animals. Obviously, we are talking about quality and veterinary control, as I said, of licensed veterinary products, registered products, probably in a next step, but coming very soon, hopefully, and being able to choose in the different ratios of medications, depending on what they want to treat and how they want to treat it. It will obviously increase the interest of pet owners to getting close to their vets and asking them and demanding from their vets to have this knowledge and to have this support. Because for the moment, many vets, and I agree with Sarah, many of them are saying, no, there is no research, but they're not really looking forward to find that research. And also many vets may just say, no, it's illegal, we cannot use it at the moment, and they hide behind that. If we open it, they will not be able to say that anymore, and they will need to go forward and learn about the use of it. I don't know if Alana wants to ask.
Yeah, I just wanted
something.
to, yes, from a cultivator and a manufacturer point of view, like in the Australian legislation, it's actually illegal for anyone in Australia to produce a veterinary product at this stage. And so
Yes.
we tried to go through the pathways of that, trying to get veterinary approval from that high up in the chain of events, but it's actually still illegal. And I guess the TGA, if they have a swing of influence and saying that it's okay, I guess it still has to be passed by the Australian legislation for Australians to actually cultivate and manufacture for the use of medicinal cannabis. But I think the loophole is that in some states they're actually allowing it. So on a state level, there is actually some grey areas in their legislation, which makes the whole process even more confusing to try and get a product approved.
Yeah, absolutely. As I said, the problem is that there are so many organizations dealing with this. Is the TGA, but as you say, it's also the state's regulations, the state legislations, is the ABPMA, is everybody. But obviously, I cannot, I don't know how to say, I cannot kill all the flies at the same time.
No.
I have to go from one to.
Yeah, we tried to do the Australian one, but at this stage we are only allowed to produce for human consumption, but we definitely will be pushing for veterinary use as hard as we can.
Yeah, that's the point. I think that if we can open one first door, hopefully that will lead us to be able to open some other doors. It's just the first step, as I said, and I tell everybody, I know this is just the first step. I know we still need to go much farther, and there is still a long pathway to go for. But at least we have the first step. And once we have this open, at least we have something that we can hold on and say, listen, the TGA is saying that it can be used in animals.
Yeah.
That's it.
We're just coming to the end of our time, Marta, but
Yep.
I think you've only got 3 slides left. So thank you very
Yep.
much. The timing's been excellent. Thank you.
We are getting there. So as I said, and I just wanted to introduce the safety and the low levels of toxicity. There is a research, and it's very old, but it's there, where 3,000 milligrams, so 3 grams per kilo of pure THC were used in canines, and there were no lethal levels for animals. And if you think or you compare that with the doses that we're using, from 0.05 to 2 milligrams per kilo, it's just ridiculous. Thinking that they're going to have issues because they are having any level of THC. Obviously, they might have, or they can have some side effects, but that's what they're going to be under veterinary control. And I cannot say that 100 times enough. The vets, the owners at the moment are having access to medicinal cannabis products. They don't know what those products contain. They don't know what they're giving to their animals. So, and they don't know what amount or what rate or what doses they're giving to their animals. So first of all, they don't know if they're using the right combination of molecules. Secondly, they don't know if they're using enough amount or if that's too low or if it's too high. If they have any side effect, they do not know what to do. And also, which is really important for me, and I've seen it before, they are taking their animals to the vets while they're using this type of medication without letting the vet know. And if the vet needs to make an emergency surgery, or it needs to make a sedation, or it just needs to prescribe any other medication, they are not aware that this animal is having these products, and they cannot rule out the drug-drug interaction because they do not know about it. So that's also another reason why I think it's basic that this medication is under veterinary control, because the vet needs to know what is happening to those animals if they want to implement any other medication, as if they were using any other, exactly the same. But yeah, I want to make it very, very clearly that the levels of THC that can be used on animals are really, really high, with very, very safety background, let's say that way. So this is my last slide, and he's asking for your help and he's asking for your support. And the application will come open by the end. I was in contact with the TGA last week, and they told me, they promised me that it would come out to be open by the end of this week, or the very beginning, or the next one. So as soon as it's out there, they will probably, Gail, we might be able to send you a link. Yeah. There will be a page related with our application in which you can add your personal details, which specific medication do you want to make your comment on, and then you have 3 different possibilities. You can just say yes, that you support our application, and that's it, nothing else to do. You can say yes and write a short reply saying why you want to support our application, or you can say no, and obviously again write a little bit of sentences, a few sentences specifying or explain why you don't want to support our application. And that will be out there, yes, as I said, by the end of this week or the very beginning of next week. So I would really ask for your support, and I would really ask you to get into that webpage and say that, yeah, that you really do support that treatment for animals. Thank you very much.